just how serious it really is? Well, joining us today to talk about common spine conditions and treatment options for back pain is orthopedic surgeon with Connecticut Orthopedic Institute at St. Vincent's Medical Center, Dr. John Awad. Doctor, thanks for being with us today. We appreciate it.
Good afternoon. How are you doing?
Pretty well. Listen, first, what are some of the most common conditions of the spine that can be trouble?
Yeah, I mean, it really depends on your age, obviously. You know, young children, they tend to have more muscular, issues. Some of them also can get, stress fractures. And then as we age, it's more of the wear and tear, phenomenon, where you can get arthritic conditions in your spine that can cause pain. Sometimes you can actually, because of the arthritis, bones can start to shift, and that's when you start getting pressure on the nerves and developing certain conditions with those. And that's the majority of what we see in terms of the lower back.
So we've all, had a stretch where, gosh, we did something to our back and it hurts. When do you know if it's just some garden variety thing or you should really reach out for help?
Yeah, if the garden variety stuff typically will get better, start getting better over the next few days, and then usually within, a couple to a few weeks, it's, you're back to being, back to yourself, fortunately. When you have to really start seeing care, if it's getting progressively worse, or you start experiencing a lot of severe nerve pain, that's when it's appropriate to, seek help from a physician.
So somebody comes in with that kind of problem to you. What are the typical ways you treat that kind of back pain?
Well, depending on what they're presenting with, sometimes we'll get some imaging such as x-rays or MRIs. And then usually we'll do some type of anti-inflammatory, some of them over the counter, some of them are prescription, depending on the, the severity of their pain and the type of pain they have. And then typically we'll start with some physical therapy if that's what's indicated. And then if that doesn't help, then you can get more, more significant treatments such as injections, and, hopefully never, but, it can lead to the point of surgery. But that's fortunately very uncommon.
If you get to that level of surgery, there are some less invasive options, right? And some new treatments too, correct?
Yeah, so there are definitely less invasive options where we're making much smaller incisions in the skin and, basing it now on a lot of navigation where we use robotics and imaging instead of, opening up the back and looking at it directly. We're using indirect visualization so we can make much smaller incisions and a much faster recovery.
Good news. Briefly, tell us, you got a class on back pain coming up. Tell us about that.
Yes, so on August 4th, on Thursday, August 4th, we're having a kind of an interactive class where we'll be discussing a lot of these, in further detail.
If you got trouble, check it out. Doctor, we appreciate it. Dr. John Awad, St. Vincent's Medical Center. Thanks for your time. Have a great afternoon.
You too. Enjoy the rest.